Welcome to Lessons in Framing Overdose Prevention, Considerations for Rural Communities. My name is Merlene Tucker, and I'll be running today's web forum along with my colleague, Jeff Bornstein. Today's web forum is sponsored by the National Overdose Prevention Network, a program of PHI Center for Health, Leadership, and Impact, and produced by Dialogue for Health. Let's meet the moderator of today's event, Dr. Mary Maddox Gonzalez. Dr. Gonzalez is a coach and preparedness consultant for the California Overdose Prevention Network, a program of PHI Center for Health, Leadership, and Impact. She served as the Sonoma County Public Health Officer and Division Director and the Chief Medical Officer of the Redwood Community Health Coalition for Sonoma, Napa, Yolo, and Marin counties. She has been a board member and chair of the Latino Coalition for a Healthy California. Welcome, Mary.
Thank you very much, Marlene. And it's my pleasure to welcome you all to today's National Overdose Prevention Network webinar. Could I have the next slide, please? We'll be asking you a few poll questions initially, and then we're going to have some really interesting questions during the presentation also. As you've heard, this is focused on considerations for rural communities for framing overdose prevention, such an important issue. And just by the number of individuals who have signed up for today's webinar, we see this as of great interest to many of you. You are really the experts in this. Many of you are doing frontline work. We are very interested in getting your perspective, questions you have. So as Marlene mentioned, please do put your questions in the Q&A. Could I have the next slide, please? Today, you're going to be exploring how you can use layers of strategy to be more effective in shifting the conversation around overdose prevention. You're also going to learn how to recognize different starting points, opportunities, and challenges when you're advocating for solutions that you are seeking. Also, you're going to better understand some of the very unique challenges in talking about overdose prevention in rural communities, including how you can counter some of the dominant framing of overdose prevention. Can I have the next slide? Okay, well, I'm going to introduce today's speakers. Kim Garcia is a media researcher at the Berkeley Media Studies Group. They joined Berkeley Media Studies Group to support news and content analysis on social and health equity issues. In this work, Kim brings more than 10 years of experience in both quantitative and qualitative methods, primarily in the field of public health, but with a focus on race, class, gender, and youth development. She also has a lot of expertise in data visualization, graphic design, writing. And Kim has roots both in the Philippines and Canada, and very importantly, brings an internationalist lens to her social justice work. She has a master's in public health from the University of California, Berkeley. Ingrid Daphner-Krasnow is a strategic communication specialist with the Berkeley Media Studies Group. She provides media advocacy training and strategic consultation. She brings to her work more than 50 years of experience in reproductive justice policy change, grassroots communications, marketing strategy, fund development, a lot of different experience. She also has a master's of public health from UC Berkeley. Oh, excuse me, from UCLA, undergraduate from UC Berkeley. Well, please join me in welcoming Kim and Ingrid. Thank you so much for joining us.
Thank you so much, Mary, and to the whole NOPIN team and Dialogues for Health team. We really appreciate being invited to speak here today and appreciate the warm welcome. If we could go to the next slide, please. Again, we're here to talk about lessons in framing overdose prevention, specific considerations for rural communities. So hopefully you are in the right place. We are going to be talking about broad considerations related to strategic communications and how to apply those in the rural context. I also just wanted to share, I've spent a good bit of time the last decade plus in rural Wyoming. So I do have some experience understanding what are some of the public health challenges that are really relevant to rural communities, and understand that it's not an easy job what folks on the call are dealing with, especially related to overdose prevention. So I just wanted to acknowledge that and say thank you for all your good work. Next slide, please. A little bit about BMSG, if you're not familiar with what we do. We do a few different things. We conduct media research on how the news frames public health issues currently and retrospectively. Sometimes we'll look back in time and look at how issues have been framed in the news previously, what we've learned from that experience, how it's changed, and what we can be doing better, as well as what's going on currently. And Kim's going to share their work on looking at how overdose prevention has been framed in materials and messages related to the prevention of overdose, so that we can all be learning from that, especially in the rural communities for today. We also train advocates, folks in the government sector, folks in nonprofit organizations, on how to use media and communications as a strategy to reach decision makers. So we're in the business of capacity building. We like to be behind the scenes to help folks understand how they can use strategic communications within their roles to advance the work that they're doing. And we also work specifically with journalists. We know that a lot of times news is framed very much from an individual perspective. We really want to widen that frame to show how community health, how social determinants of health, how equity issues are often left out of news stories. And so we work specifically with journalists to help them do their reporting more from a solutions-based perspective. And we're a program of the Public Health Institute. Next slide, please.
Great. Okay. Well, thank you so much again for the lovely introduction, Mary, and thanks, Ingrid, for getting us started. So we just wanted to share a little bit about the background of this project. So as many of you here know, overdose prevention saves lives. And while there are many successful and proven strategies for substance use treatment and prevention, they aren't really well known or widely available and can be especially limited in rural communities. Worse, they can be characterized as controversial and plagued by misinformation. So while some have taken to social media to share life-saving information, we know that many of you advocates are continuously working to counter misinformation, stigma, and pushback from the public, service providers, law enforcement, and government leaders. So the National Overdose Prevention Network, NOPN, partnered with us at Berkeley Media Studies Group to develop a message guide to support you all in your efforts to communicate more effectively about substance use treatment and overdose prevention. And we will share this full guide. We'll publish it in a few weeks in July. So we'll be sure to make sure that all of you have a copy of that. And so just to give a little bit about our methods, how we approach this project, we really wanted to understand what were these narratives about overdose prevention. So what were the stories kind of shaping these conversations? So we analyzed existing resources from around the country, a lot from NOPN, who has an extensive library of materials, including toolkits, webinars, and reports. And we also wanted to talk with experts to see how they're talking about overdose prevention in their communities. So we interviewed experts across California in rural communities as well. These included physicians, outreach workers, health educators, law enforcement, and coalition leaders. And we really wanted to get some of their firsthand experience into the challenges and opportunities for effective communication. So in this presentation, we'll share a few of the strategic communications tips and tricks that will be featured in this final messaging guide. And again, we'll publish that in a few weeks in July. So today we really wanted to share some of our learning objectives. Next slide, please. We'll talk about our approach to communications, which is really rooted in an overall strategy. So one of the main things to take away from today is message is never first. So we'll share some of the foundational steps to build out your overall strategy that will inform the rest of your communications. We'll also talk about some of our research findings that provided insights into how to talk about substance use and overdose prevention in rural communities. So we'll share some of those specific challenges and opportunities, especially as you approach your message development and tactics for getting your messages out there. And finally, we'll share about some of the different frames or lenses that people may encounter while communicating about overdose prevention in rural communities, why those frames can create mental barriers, and how to craft your message to put people on the path to better understanding why and how overdose prevention saves lives. Next slide, please. So, how do we get better at communicating about overdose prevention? Our answer is strategic communication. So, as I said earlier, message is never first. Before you can decide what to say, you must know what you want to change, who has the power to change it, and why it needs to be changed. Often, when people don't know what to say, it means they don't know what to do. So, I'll have Ingrid tell us more about our approach to strategic communications.
Thanks, Kim. So BMSG's work is grounded in the foundation of what we call the layers of strategy. And like Kim said, we really focus on the idea of understanding what's the problem that you're trying to solve and letting that guide your communication strategy. So when we talk about overall strategy, we're talking about answering the question, what's the problem that you're trying to solve? What's the solution or the solutions that you see as integral to solving that problem? Who are the targets, or who's the target or the body who has the power to make that change? And ultimately, how are you going to influence those people to make the change that you want to see in the world? So like Kim said, it's hard to know what you want to say if you don't know what you want to do. So this overall strategy layer really helps folks understand what is it that they're trying to change, what is the solution that they're seeking before they can start to move into their communication strategy. The following three layers, media strategy, message strategy, and access strategy, are all related to those communications tactics that we'll be sharing about later on in the webinar of how you can reach the decision makers who are in positions of power to create change. And Kim's going to put if they haven't already, a worksheet with information on the layers of strategy in the chat so that you can follow along and also keep this as a reference for after the webinar. Next slide, please. So I got a little ahead of myself. I get very excited talking about overall strategy, but just to have the nuts and bolts of what that overall strategy is. So we're defining the problem we want to address, the solution that you're trying to propose to move forward. We understand usually there are multiple solutions for any given issue in the community, and you'll hear us talk about identifying one singular solution at a time when you start to work on your messages. Understanding the target who has the power to make the change that you're seeking. Who are the allies who can help you make your case? None of us can do this work alone. So who are your partners in the community that you're working in, outside your community, who can help you make the case to influence the decision maker who's in that position of power? And then ultimately, what are the actions that you're going to take to influence your target? What are the steps? What's in your, if you are in the public health world, what's in your logic model that's going to help you go from point A to point B to point C? And ultimately, where are the communications tactics grounded in that? Next slide, please. Great. So when we're talking about overall strategy, and this is where we were going with our question around what are some of the challenges that folks in rural communities find, is one, there's specific issues related to equity. And we want to remind folks, and we know that you all know this, we know this as well, that rural communities are not a monolith. Folks in rural communities see all different kinds of issues around their regions and their communities. There are some issues that are similar in some rural communities and some that are different. And some of the similarities we wanted to show here. One is just that the supply for solutions, the supply for treating overdose prevention are much more limited in rural communities. So just that scarcity can be an issue unto itself. Also, stigma related to seeking treatment for overdose prevention and for substance use can also be much higher in rural communities. So that's something that we want to be factoring in. And then outreach. Rural communities are more dispersed, so it may very geographically, literally be harder to reach members of the community in rural areas to provide treatment, to provide support. And so we need to factor that in when we're thinking about messaging. How widespread are members of our community? How far away is our nearest neighbor? How far away are the treatment providers that we have? So we need to be factoring in those issues, as well as I'm sure a number of other issues that are relevant to rural communities. Next slide, please. One of the ways that we think about addressing strategic communications is, what is the door through which someone comes to bring this relevance to their particular issue of interest? And so one of the things that we've learned from working with the National Overdose Prevention Network is that there are typically 4 different doors, 4 different points of entry for folks that are working on overdose prevention. And these are the doors through which we will be walking through in learning about message development and delivery in our webinar today. So one is the prevention of new addictions. We want to make sure that if there are folks addicted, that we try to help those folks get the treatment that they need and prevent any new addiction. So there are folks that are coming to this perspective or coming to this work from that perspective. There are folks that are coming to the work from the idea of managing pain, who are safely. So folks who are using opioids to work on pain management, but we want to prevent addiction of those pain management tools without having folks get addicted. Treating addiction, so folks that are already on the journey of addiction and really trying to step back and learn how to recover from addiction and treat that addiction. And then ultimately stopping overdose deaths, making sure that if someone is at risk of overdose, potentially does overdose, what are the tools that we have in our pockets to help folks make sure that we keep people alive and well. Next slide, please. So when we talk about overall strategy, again, we want to just really drill down into these key components of your overall strategy. So we're going to be talking about the target that has the power to make the change that we're seeking, and the allies that we see as most important in the work that we're doing. Next slide, please. We also want to think about how we are framing an issue. How are we characterizing the issue that we care the most about? What is the issue that we think is going to be most relevant to the target that we are trying to reach? The message is, what are we saying about that issue? How is it relevant to what the folks that we are talking to are interested in? How can we make it most salient? Who is the messenger? Who is going to be saying the message? And again, who is that target? And I will pass it back to my colleague, Kim, to just get us into a discussion on framing.
Thank you so much, Ingrid. So framing is something, that we look at a lot in our work because we know that people come to new information they see or hear with ideas already in their heads about the way the world works. And so these existing notions can form these mental structures or conceptual frames, and it can allow us to categorize information without even knowing it. And frames matter because they can foster certain understandings and hinder others. And as you can see in this example on this slide, often all it takes is a single word to activate an entire frame that then determines the deeper meaning of that word or image. And once activated, frames can trigger emotions, associations, values, and judgments. So they can create tracks for a train of thought, and once on that track, it's really hard to get off. So, one of the most dominant frames in the US is individualism. And this frame we have here on this slide, drug use is wrong or dirty, really reinforces that language that, substance use is associated with filth. It's invokes like punitive bias, individual shame, moral failing. And so one thing we heard in our research or found in our research is to reframe this is to really think about substance use disorder as a health condition. So moving away from the negative consequences or saying that drug use is wrong. And by framing substance use as a health condition, it may help people be put on the path of considering that substance use is treatable, preventable, with healthcare access, and we can improve people's health and well-being. Next slide, please. Another thing we heard, especially in rural communities, is some people may think that substance use and overdose prevention is a big city problem. And unfortunately, this ignores the reality of substance use disorder. So some people may say there are no drugs in my community, so it's not my problem. A possible reframe is to say that overdoses and poisoning can happen to anyone. And 1 in 7 Americans in their lifetime will have a substance use disorder. So one important shift here is not just characterizing overdoses alone, but also thinking about poisoning, really thinking about expanding the frame to include people who may have multiple prescriptions that they're managing and may not be aware of the potential poisoning effects. One of the experts we spoke to also said, do you have friends? Do you have children, babysitters, grandparents? It could be you, or if you have an uncle visiting and drops a pill. Let's be prepared rather than not, because it's a life and death situation. We have the tools to help this. So really normalizing the situation and sharing stories. And I think someone from the audience said, that these issues are stickier when people feel they don't have anonymity. And we know that the stigma is really hard to overcome. So really normalizing these conversations, sharing more stories is really important. And we'll get into some more tips about that later on in our presentation. And another useful tool that some people have shared in our interviews is using overdose maps or odd maps data to show the number of overdoses in your community. So, for example, one person shared that when they were presenting to a school about overdose prevention, that they pulled up a map of where the school was in their community to get an evidence-informed set of data to look at how much overdose affects them in their own communities. So that's just one potential way also to illustrate the scope of the problem. Next slide, please. One of the other dominant frames that we heard is harm reduction enables drug use, especially among concerned parents who may think that a tool like Narcan gives kids superpowers. And this unfortunately really reinforces stigma and misinformation about overdose prevention. And one thing we heard from some of the experts that we spoke with as a potential reframe is to think about harm reduction is healthcare. Just like doctors reduce harm from disease or illness, and there are decades of evidence supporting medication and treatment for substance use disorders. So medications are treatment tools for other diseases, and substance use disorder shouldn't be treated any differently. This once again connects to that first example where really emphasizing that substance use disorder is a health condition, it is treatable, it is preventable, and we can all work together to improve our health and well-being of not only ourselves, but our communities. So these are just some of the frames, and in our final message guide, we'll have a more comprehensive list of some of the other frames that we found in our research. And I'll hand it back over to Ingrid on the next slide to discuss more.
Thank you, Kim. So Kim just gave us a brief introduction to some of the frames that they've seen in the research so far in the message guide. We wanted to take a step back before we get into some of the more specifics around the components of effective frames and talk about research that's been done by a cognitive linguist named George Lakoff, comes out of UC Berkeley. And Dr. Lakoff has really talked about these 3 different levels of messaging that seem to be the most effective when we're thinking about how to communicate with our particular target audience, and seem to be not only effective, but the common practice, whether or not we're thinking about it. So the first one is the foundational value. You can see this is shaped like a pyramid because foundational values are the broadest concepts that are communicated and the most effective when we think about what's going to influence someone to make a decision that we want them to make. So thinking about justice or unity or interconnectedness, other values that we share across communities, regardless of our particular perspective on an issue, is going to be the most influential and is ultimately the most important part of a given message. So we think about that as the base of our communications pyramid. We next think about our topic area, like housing or jobs. In this particular issue, we talk about overdose prevention as our big thematic area, but we talked earlier about the 4 doors that people walk through. Maybe it's prevention, maybe it's treatment, maybe it's prevention of death. So what are the specific issues that we can connect to that are going to be relevant to the target audience that we're seeking, that may be more narrow than our broad concept of overdose prevention? So in the community that we are talking to now, we're thinking about rural communities, which is going to be more narrow than our national audience. But even within rural communities, what are the issues that are going to be most relevant to the particular audience? And then level 3 are the details of the policy approach. So this is the again, going back to your logic model, if you're public health folks, what are the step-by-step processes that you need to implement to see this change enacted? And ultimately, what is that really specific solution that you want to see that's going to have an influence over the outcomes that you're seeking. So we just like to give this as a general overview of how to approach message development, with a reminder that values are going to be the foundation, then getting more narrow, thinking about how you're going to connect your issue to the issue that is relevant to the people that you're talking to. And then you can get into the policy approach. Oftentimes we want to get right into the solution, that top triangle in our pyramid, when really we need to be starting at a more fundamental level. So I'm going to pass it back to Kim to talk about some of the values that they saw in the research in doing the message guide.
So, in our research, we identified a few different values languages or values language that can help your message reach people not just in their heads, but in their hearts. So, our messages really need to explain why they matter for everyone, even those who may not always see their personal connection. The values part of the message expresses how we are connected to one another. And by using the words like our to convey interconnection, help to illustrate that we are in this together with our neighbors and our community. So um, some of the values that we saw, especially, which I see people putting also in the poll, are dignity, respect, health, care, compassion, love. We also saw some values of accessibility, especially in rural communities. We want equal access, fair access to healthcare. Preparedness was another value. You know that these are overdoses are preventable, so let's be prepared. Safety, and some other values that we saw, or some messages that incorporate some of these values. A succinct one about community. Someone said, opioid abuse or misuse is a community-wide epidemic that will require a community-wide response. So, really bringing it back to our communities and saying, this is not an individual problem. This is a community-wide problem for all of us in our community to respond to. Um, Another value that came up in our interview with a former law enforcement officer was responsibility. And for those who are working in law enforcement, those who are first responders, boots on the ground, often maybe have to confront people experiencing overdose. So honing in on the value of responsibility can also be an effective value. So saying something like Narcan is a tool. This is a tool for you to use, just like all the other tools you have on your tool belt. Um, Another value that we saw come up, especially relevant to perhaps conservative leaders or people with conservative values who are really concerned about the bottom line, what is this going to cost me and my community, is economic benefits. And so one of the messages we saw was that MAT, medically assisted treatment, or medication assisted treatment, can avoid the high costs of treating overdoses. It can lower emergency department costs, hospitalization costs. So really underscoring the economic benefits of harm reduction can maybe appeal to some of those conservative values. Next slide, please. So now that we've given you a little bit about the overall strategy, a little bit about some of the frames, the backdrop against which you are going to be talking about overdose prevention, some of the values that can help bring your messages to people's hearts, we want to share some basic components of developing your message. Back to your overall strategy, thinking about what is the problem? What's wrong? What are your values? Why does this matter? And what is your solution? Who should do what by when? And so these are just some of the key building blocks to developing your message. In these next few slides, we're going to share a couple of examples that were raised out of our interviews to help illustrate how you can bring all these elements together in practice. And we will be asking you all for your feedback through another poll after these messages. So um, we'll get through this and hopefully we can get some of your feedback because we recognize we at BMSG are not the experts here. You all collectively have a lot of expertise, and I see in the Q&A a lot of really interesting nuances and considerations. So really would appreciate all your feedback. So next slide, please. So this is an example that came out of a couple of interviews where people mentioned that the problem that they're experiencing is funding cuts to harm reduction programs. So we know that harm reduction can decrease the risk of infection. It can reduce the number of emergency room visits and reduce healthcare costs overall. But they're faced by maybe conservative leadership, new leaders who are making budget cuts. And so the solution that we heard is we need to reinstate funding to harm reduction programs. So I'll read this message aloud and then identify some of the components of the message development that we talked about earlier. So this message says, we want people to be happy, thriving, and well. However, for us in overdose prevention, our ability to serve our communities has been undermined by funding cuts to harm reduction programs that take care of our neighbors, families, and friends living with substance use disorder. That's why I'm calling on our government leaders to reinstate funding to harm reduction programs so that our communities have equal access to services, equal access to care, equal access to the things that treat the mind, body, spirit. Research shows that harm reduction programs can be cost effective and save money in the long term. By restoring funding, we keep our communities safer and healthier. So just to highlight this, in the gray, we have some of our values language, happiness, wellness, taking care of our community, again, using that word our to really emphasize that interconnection. Also talking about the economic benefits of harm reduction programs and keeping our communities safer and healthier. In the black highlighted text, we've outlined our problem, which is funding cuts. And in the yellow highlight, we're talking about restoring funding, reinstating this funding, and we're calling specifically on government leaders to do that. So our target audience here would be government leaders, maybe public health department leaders who can help support reinstate funding. So this is just one example that we actually heard specifically from coalition leaders who are kind of working on getting their funding back to support harm reduction programs. So another message that we developed was specifically around law enforcement. So we have heard in some of our interviews that um, law enforcement might have a lot of misinformation or fear when dealing with substance use or overdose. And when we spoke to a former law enforcement officer, this person really shared, some of the values of law enforcement, that they're really about serving and protecting their communities. So the solution that this person shared was education and training to really provide law enforcement with accurate information to counter some of the misinformation that's being heard. So this particular audience will be law enforcement, and I'll just read the message out loud and again go over some of the components we described. So, as law enforcement officers, our aim is to serve and protect our communities. However, when there is misinformation about substance use and overdose prevention, we can't perform our duties responsibly. If we don't try to save a life, there is no chance of recovery. That's why I believe law enforcement should be educated and trained on substances to get accurate information that can keep our community safe. I will share some overdose prevention strategies, but I'm not going to force you. I just want to give you the facts and let you know that this is a resource that could save someone's life. So, this particular person really shared that, again, law enforcement are really interested in serving and protecting their communities. They may also resist mandated or requirements. So providing this as a tool in their tool belt rather than a requirement may help to bring in some of that buy-in from law enforcement. We also heard from another interview that, if we don't try to save a life, there is no chance of recovery. And we thought we'd bring that into this message to really bring home the point that if we don't even try to offer that first next step to get people to treatment, that there is no chance of recovery. So the solution here, again, is to have education and training to get more information out there, and so that law enforcement have the tools they need to respond responsibly. Next slide, please. And Ingrid will tell us a little bit more about messengers.
Great, thank you, Kim. So everything that Kim reviewed related to a message, the strength of a message, the values associated with a given message, who the messenger is and who the target is makes a huge difference in how that message is received. And so what we think about is, what we think about when we talk about this is message strategy. So in rural communities in particular, messenger is so critical. And we know that messengers in rural communities may actually play multiple roles, maybe messengers for multiple audiences. So oftentimes they're longtime community members with a long history in a community, deep knowledge of the networks. We also know that insider versus outsider messengers are really important. So are they folks who are within the government, like representatives, members of a substance use prevention or treatment agency, who could talk to other government representatives, who may trust their colleagues more than someone who's considered, an outsider from the government agency? The champions who can speak directly to the leaders of hospitals, health organizations, health and human service agencies. So those folks who are very well known in the community for being champions around overdose prevention are going to be much more effective in rural communities because of that interpersonal relationship. Also, folks who have professional expertise across an issue, like pharmacists or other physicians, who may understand how something like naloxone is effective in preventing overdose. How can we make sure that our policymakers are informed by the science and they know how effective some of these tools are? And finally, we also find that a neutral convener, someone who may not sit in one camp or another, but may have relationships across different spectrums, but understand the historical conflicts and tension across those communities, might be really effective in bringing people together. And one of the things that came up in our research was that we heard from advocates about bringing people to the table and the challenge of everyone having expertise and believing that the solution is the right one. The key is that we want to make sure that we hear each other's challenges and understand each other's expertise. So again, when we're thinking about message, we really need to also consider who's the messenger and how does that messenger align with the target audience. Next slide, please. So we're going to give you just a couple tips on message delivery. These are elements that are relative to the national audience as well as the rural audience, but these particular tips are going to be really effective in rural communities because of that interpersonal connection. So one, storytelling to reduce stigma. We know that stigma is such a big issue in rural communities. So how can folks share their stories in meaningful ways that help people understand that we all have our struggles? We all need to have empathy and understanding from our community. And so how can we try to reduce that stigma in rural communities by sharing stories that are going to help people understand that we're all in this together, that we all face our particular challenges. And we really want to shift away from blame or shame or victimization. So personal stories that are focused on one person's experience that shows how the context or the systems and structures may have had an influence over that person's experience, and how the solution really also needs to be grounded in those systems and structures. That's where storytelling can be really effective. Next slide, please. Also using metaphors. So if we compare overdose prevention and harm reduction to public health and safety tools like fire extinguishers or CPR, seatbelts or car seats or stop signs. Those are instrumental in helping people understand that the solutions for overdose prevention, again, are tools that need to be implemented at the systems level, that need to be available at a broad level so that people have access to them. That overdose prevention is just like a tool, just like a stop sign keeps people safe at an intersection, just like a car seat keeps a baby safe in a car because of what we've learned over time. Ideally, nothing happens. In a fire, we hope we never have to use, or in a home, we hope we never have to use our fire extinguisher, but wouldn't it be better if we had one available? So using metaphors to help people really understand how the tools to prevent overdose can be effective and should be destigmatized just the way these many other public health tools are destigmatized. Next slide, please.
All right, thank you, Ingrid. I know we're running up against time, and we're going to try and get through all of these access strategy tips. This is the final layer of strategy. This is really how you're going to get your message out there. And so one of the things that we learned from our communications director is about the challenges of reaching rural audiences through the media. So next slide, please. So there are many ways to get your message out there, and we learned through this process that media may not be the primary way to reach your target audience. So, but if you do decide to use the media, there are some considerations for rural communities specifically. Local newspapers may serve multiple towns or may not have the staffing or staff with skills to write about these issues. So you're really faced with a smaller media market. On the other hand, you may be able to engage directly with local reporters. So keep an eye out for articles that reference the opioid epidemic or other related issues. And when you see that news coverage, think about using those as an opportunity to write a letter to the editor or reach out to that reporter to tell them about the important work that you're doing. You can also submit op-eds to share about upcoming events or activities. Beyond traditional print media, we also learned that rural communities may use social media and Facebook groups specifically because closed discussions provide more comfort, privacy, and safety. So, especially for those really dealing with stigma, joining these Facebook groups may be another opportunity to reach those audiences who are really isolated. And finally, we recommend using grassroots tactics, analog or printed materials to post on bulletin boards to help reach aging audiences who may not be using social media. And also consider that rural communities go beyond county borders. So one interviewee that we spoke with said, we realize that patients cross county lines, the providers cross county lines, so the communications should cross county lines. So really think about building partnerships and expanding your outreach and capacity. And I know that NOPIN has that partnership mapping tool that we shared earlier to really help think about how to develop those partnerships. Next slide, please. We also really wanted to emphasize meeting with communities in their communities. So for rural areas, there may not be densely populated places, but you can consider outreaching to where people get their basic needs met. Gas stations, food distribution programs, places of worship. We also recognize that you may want to introduce new concepts in smaller groups and provide more space for questions and storytelling. People may not be familiar. And so by having, these smaller groups, you can introduce these concepts on a more personal level. And finally, I think I saw in the chat, some people were talking about some of the different ways we can learn from each other. You can consider listening sessions and inviting different perspectives. And we know that some groups may have historical conflicts or tensions that they bring to the table. So it's really important if you are that person bringing these groups together to be as neutral as possible. There may be many experts in the room with many solutions, but everyone I think can really focus on a shared goal or outcome or vision that can help overcome those conflicts and tensions. Because as one person succinctly said in one of our interviews, that, you know, if we're all paddling at different times and we're all in the same boat paddling at different times, we're going to go in circles. But if we can all put our oars in the water at the same time, we can make a lot more progress. So, on that note, I know I went through that really quickly. I really appreciate everyone's Q&A and chats and participation in our polls. And certainly when we you know, release the final guide, we'll definitely incorporate all of your valuable input. Next slide, please. I think we have a few minutes left for Q&A.
Well, thank you very much, Ingrid and Kim, for that great information. Really appreciated such practical strategies for crafting our messages, and really going through each of those considerations in a you know, kind of stepwise manner, having a roadmap for doing that. So important. We also really appreciate all the comments from the participants, you know, and really having this ongoing conversation. I appreciate some folks saying, well, you know, poisoning might be considered advantageous in one setting, but it may be it's considered stigmatizing also, so that we have this conversation amongst ourselves to make sure we're getting everybody's input. Very importantly, individuals with lived experience in that whole process. So, you know, we just so appreciate all of you joining this call. You're the experts out there. You are grappling with this very challenging situation that is, with the increase in overdose deaths, the issues specific to rural areas. We do invite you to participate in the upcoming webinar. Could I have the next slide, please? First, before that, well, I also thank Kim and Ingrid, because they've given us their information, their contact information, for you to get additional, you can have questions. We weren't able to get to questions today, but really, if you want additional information, there's the website, Twitter, Facebook. Really encourage you to contact Kim and Ingrid. And the next slide. And then we hope you'll be able to participate in Lessons in Overdose Prevention, a national conversation. This will be, in addition to the rural discussion, will include additional aspects of framing overdose prevention. This is such a complex issue. We know we're dealing with a kind of co-occurring epidemics of stimulant use disorder, of opioid use disorder, everything that this means when we're trying to discuss how we prevent overdoses. So we hope that you will join us for that. We really encourage you to consult with our website, an open website here, and to again remind you that this excellent message guide will be available, and we will be providing that to all of you who have registered for today's webinar. We hope you'll join us again for our next webinar, and we thank you so much for being with us today. Thank you, everyone. Bye-bye.